I'm Julie Bartke with Session Update. It took roughly 4 hours of debate on the Senate's $11.2 billion Health and Human Services bill Thursday night before that measure passed. More than an hour of that was spent debating how a baby should be laid in a crib. We'd like to show some of that discussion for you right now.
Currently, the law allows them to discuss that with the parent and with a written note from the parent. If the parent desires or knows their child is comfortable or is used to sleeping on the side or the stomach, they can give them a written note and give them permission to do that. This bill is now making that harder and adding a new regulation and requirement to our parents that are seeking child care, as well as our small home daycare providers and all the providers across the state, by saying you can only do it if you get a doctor's order, forcing those families to now have to go to the doctor to get that slip, and forcing those daycare providers to now have one more regulation to comply with, and taking it out of the hands of the parent and the provider.
I know that we had another tragic death just last week, I believe. I'm not certain if there were safe sleep requirements out of compliance in that one, but the fact of the matter is, in the vast majority of these instances of children dying that we all need to try to avoid, some of these deaths were preventable by things like how we put the children down in their cribs.
What this language will do is absolutely completely remove the authority of a parent to make parenting decisions for their child if it's at one of these daycare facilities relative to how they sleep. As we discussed in committee, technically it doesn't remove their ability, but it removes their authority. And that's a dramatic difference. They have the ability to make this decision for their child if they can get a third party's permission, if they get a doctor's note. If they can't get a doctor's note, they have no authority to make this parenting decision. That is a dramatic place for government to interject itself.
What do you say to that family in Hastings whose son died in a daycare center because the child was placed potentially because of SIDS, but a contributing factor to SIDS in many cases is that a child is placed in an unsafe sleep position? So how does that parent feel? Obviously indescribable pain, but what about that daycare provider who perhaps, we don't know the circumstances, perhaps had a waiver from the parent saying, put my child to sleep on their stomach, even though the daycare provider knows that that's not the best practice, or that's not recommended by the medical community or from people who have more expertise certainly than any of us in this body. I just think that this argument of, oh, we're crossing the line is a little bit, it's not looking out for the best interests of the children.
The bill passed with a 36-28 vote. DFL Senator John Marty cast the lone dissenting vote. To continue following the activity at the Minnesota Senate, you can continue to follow us on our Twitter, Facebook, and our YouTube accounts.